most recent example of this is Baylor University 2004, where they took people who had severe osteoarthritic knees. They couldn't walk across the room without severe pain. Many of them were using walkers. They set up this research at Baylor University where they took half of the group to the operating room, put them under anesthesia, made 2 little incisions on each side of the knee, but then immediately sewed it back up and sent them to the recovery room. Did nothing, did no surgery. The other half, they did the same thing, took them to the operating room, made 2 little incisions, but this time did the standard arthroscopic surgery to tidy up the cartilage, clean it up, so sewed it up, sent them to the recovery room. Over the course of the next year, both groups had equal resolution of joint pain, increased mobility. The results were identical because both groups, the group that received the placebo procedure, truly believed they got the procedure, but they didn't. It's been done in 1958 and surgical for the coronary artery procedure at that time. Multiple personality disorder is another example of how the mind governs the body, in that one personality will have an allergy to orange juice, another personality brought in by a psychologist, and the allergy, say hives or asthma, will disappear. The most striking example is diabetics with ketoacidosis, which is a medical emergency. It's where the blood sugar is way too high, the patient is in an acidotic state. It's a medical emergency. People can die in ketoacidosis. Psychologist comes in, brings a personality into consciousness that does not have diabetes, and the ketoacidosis clears on the spot. This is the surgery I told you about. There was 180 participants done at Baylor University. Most patients said their knee pain had improved. They continued to say they were better for 2 years as they followed their progress. This is some of the research in the American Journal of Clinical Hypnosis on multiple personality disorder, allergy to citrus fruits, allergy to cats. When a non-allergenic personality came in, the person could play with cats with no rash, no wheezing. Allergic to cigarette smoke with shortness of breath and wheezing, and one personality was free of all symptoms in a smoking environment, and a second personality. There's also research on epileptic seizure disorder. This was a study done in 1968 at Harvard, where they took 13 medical students to a psychic healer within 24 hours of developing a common cold. Each student was given a questionnaire about their symptoms and their beliefs. They tested the antibody levels in their saliva. Your saliva contains secretory IgA. It's a first defense in the airways, in the mouth, and the digestive tract. The people who went to the psychic healer, 69% felt their symptoms had improved and their secretory antibodies were higher. 70% of these people improved by having a psychic healer telling them whatever the psychic healer does, telling them that they were better. Indeed, they were. Buddha said it very simply: all that we are is the result of what we have thought. The mind-body connection, again, it's not truly a connection, it's a oneness, but it's governed by these systems. The central nervous system using electricity and neurotransmitters, the hormonal system, and then the immune system has very short-lived communication molecules called cytokines. Cytokines is what gives you flu symptoms. You get a flu, you're achy and feverish. That's because of a healthy inflammation and it's all engineered by these cytokines. They're called interleukin-6, tumor necrosis factor, NF-kappa beta, and more. So the stress system, its sole purpose is fight or flight, to help people escape danger. The control center for the fight or flight system is the emotional center. It releases hormones, adrenaline and cortisol. Everybody knows why zebras don't get ulcers. It's because they dance. See how they dance? It's very nice. Except for this guy. Zebras don't get ulcers because zebras don't think. They run from the lion and they don't contemplate how fast the lion was running later in the evening. They don't mumble to each other, grazing the night away, about how many lions live in the neighborhood. Humans, on the other hand, would be posting on the website, would be researching how fast lions are running, or is there some change in lion speed these days? Humans would make all kinds of dangerous worries about how fast lions run. We have the same nervous system as both the zebra and the lion. Sympathetic nervous system prepares us for fight or flight, running instantaneously by accelerating heartbeat, opening up the bronchi to get more oxygen, inhibiting the indigestive tract, dumping sugar from the liver into the bloodstream so that the working muscles, as they run or attack, have enough fuel. Once the zebra is safe, then the parasympathetic nervous system clicks in with equal intensity and restores everything back to balance. This system, the parasympathetic nervous system, governs the long-term projects in your body, which include immunity, digestion, and hormone production. When this is turned on, this is turned off. Many people in our society are turning the sympathetic nervous system on throughout the day repetitively because of soft forms of fear called worry, anxiety, or apprehension, or soft forms of fight, which are anger, frustration, resentment, and guilt. Basically, that survival system, which has helped us survive on the earth, is now killing us off through stress-related diseases. Cortisol is a hormone everybody needs to understand. Cortisol, because as much as we worry, feel anxious, frustrated, guilty, whatever, this is the hormone that is elevated in your body to allow you to meet the danger by running or fighting. Problem is, we don't run or fight in relationship to our fears. We worry about financial problems, but we don't run. We get angry at the freeway traffic jam, but we don't fight. And so these hormones stay high. And this is what they do. Increase food cravings, increase fat storage, decrease muscle mass. The reason they do that is because they're making available proteins and nutrients so you can escape. But we don't escape because our dangers are not suitable for any physical action. Basically, our body is a living in the hunter-gatherer times when dangers were real and physical. We live in modern times where our dangers are no longer real and physical. They have become mental.